Good morning, or actually, good afternoon, everyone. It's Doug Edwards here in Phoenix, where it is still morning, actually. But it's my pleasure to introduce Dan Gemp, who's in Baltimore, Maryland. And he is the president and CEO of Dreamscape Marketing. And his session today is making your website your top source of admissions. Now, ladies and gentlemen, do remember that you can ask questions on the side of your screen. We'll hopefully have some time to address those at the end of the presentation. Without further ado, Dan, the stage is yours.
All right. Thank you, everybody, for joining us at NCAD 2020. I am actually local, and this is where you would have been, but thanks for joining the virtual edition. Today, my presentation is called Making Your Website Your Top Source of Admissions, where you will learn how to make your website your top source of admissions. I am Dan Gemp. I own Dreamscape Marketing. We're a digital marketing agency specializing in substance abuse and mental health. We've been around for 15 years. We've worked with treatment centers and private practices in 39 states. We've launched over 600 websites, actually getting pretty close to the 700 mark, just in the industry. And we've run over 400 treatment centers digital marketing campaigns over the years. So I'll be sharing a lot of fact-based, data-based approaches today with a little spin on how to update your methods to apply to the current pandemic scenario, COVID-19 communication in specific, and a few of the channels that are working best on digital marketing in the current environment. So the agenda today is to satisfy multiple audiences through digital marketing best practices, right? How do we do that? And realize that you're speaking to multiple audiences way more than usual through the internet right now in particular. I also want everybody to learn how to incorporate marketing tools that effectively address their audiences, right? It's about that refined targeting, the right tool for the right job. I'd like everyone to learn the latest paid, organic, and Google search trends. Things have gotten a little bit crazy, but it plays out in your favor as an industry. And I want everyone to know how to increase conversion rates through website design improvements. When we build our websites, it's not just for beauty. It's not for your opinion. It's based on user experience, preferences, things like that. And we'll be working to refine and customize messaging to these multiple channels, as well as boost your rankings on search results and general traffic with the latest technology. And at the end of all that, you should all be able to understand and deploy the multiplier effect on your marketing. So how can you take everything digital right now and leverage what could or should be happening out in the real world, if that even still exists, and capture more market share through digital? So the first question, right, what we all need to ask is your website reaching multiple audiences effectively? I don't just mean, is it reaching multiple audiences? I mean, effectively. I can't tell you how many clients ignore Bing as a search engine, for example, right? Google does have dominant market share, but for Bing to have 8%, 10% market share, we're talking millions and millions of searches. So at a very simple level, when I'm talking about multiple channels and multiple audiences, don't forget, do not ignore in these current conditions, potential market share, even on a smaller platform addressing a smaller audience. So your website best practices, right? How do we begin to address and speak to multiple audiences? Is your website well constructed, okay? Is it properly optimized from a technical standpoint, not just SEO, but user experience? I can't tell you how many sites just have a button that says treatment, right? And I think that you all need to focus a little bit more on retail level keywords, a very, very simple navigation process, right? You're either talking to someone that might be in a rock bottom emotional state, or the mother or loved one or spouse, of somebody struggling with addiction and mental health crises. And all of this is at an all-time high right now. The statistics that have been published on 2019 overdose are just infuriating, to be honest. Talk about something that was already at epidemic levels and now add social isolation, 40 million people out of work. I mean, there are so many societal factors, abuse, domestic abuse, and scenarios that are resulting from lockdown. So does your website talk to all of those people and their loved ones? Google obviously dominates the marketplace as a channel, but the content that you're feeding into Google matters, right? You need to produce content that they embrace, that they rank well, but you can't ignore channels like Bing and Yahoo and the types of content they're looking for. Sometimes it's just a different format. So let's look at Bing, for example, right, as an alternate channel. Hundreds of millions of inquiries every month, but we all ignore it because Google has more market share. It's the dominant player. Literally yesterday, Google's CEO was brought before Congress to discuss potential monopoly or not. So why would you want to miss out on these inquiries? Why would you want to miss out on these prospective patients? And quite frankly, why would you do them a disservice by failing to provide educational resources for them? So realize just at this, first level, this is an ever-changing landscape, right? Algorithms change constantly. Google search results change constantly. And you cannot afford to ignore multiple marketing channels. So the external reasons that you aren't reaching these multiple audiences effectively, and I'm not really asking, I'm telling you that most likely you're not reaching these audiences effectively. Let's look at very simple tools and how you're using them. Is your Google My Business correctly, consistently, and completely set up? This is a free tool. Many companies cannot say yes to that, right? So there's a free tool that can drive you inbound business and you didn't even set it up. This can actually result in a red flag to Google, right? It just not completing your profile, then they don't know who owns it, who controls it, whose phone number is showing up for your business name. That was an issue a few years ago with unscrupulous treatment providers stealing the listings of others. But there's something coming, and I've been saying this for a few years now. Google seemed to be investing more and more time into their review system, Google My Business in general, the integrations with Google Maps, and the fact that they own the Waze navigation app. Well, what was coming? Soon there will be a premium version of Google My Business for $50 a month, and they will make billions and billions of dollars from that. And you should all participate. It's a phenomenal tool. So to reach multiple audiences, right, you need to be tracking where these visits are coming from. Are they coming directly from a Google search, or are they coming from Google My Business, which is a very cost-effective channel? You need to have a call tracking number on that Google My Business account, right? A lot of people just have their landline, and that's okay, but don't you want to know where that business is coming from and how potentially valuable that channel is? So this increases efficiency. This can shorten the time it takes to convert qualified leads. If you know where they're coming from and you invest your time into that channel, you'll be highly efficient, both on budget and time. Additionally, Google added specific functionality for your COVID-19 hours of operation and protocols. You'd be wise to take advantage of that and fully update that profile. How good is your relationship with former patients? Okay. And don't assume you're correct on this. If they haven't told you, then you don't actually know. Your former patients need to maintain a relationship with you. You need to cultivate this. You need to provide information, become a support network, build a community. And whether you're a large residential treatment center or a private practice, this is the case. I get a call from my college. I went to Villanova, and they call me all the time, almost weekly. And I'm sure they're looking for donations, but every now and then it makes me feel special. So to become a part of a community, to become an alumni, has evergreen value. It shows that you care, and I'm more likely to, if I ever needed your service again, come back to you or refer a loved one or friend. So an organized alumni program, this is another channel, right, is the best way to keep in touch with former patients. Maybe a dedicated staff member, maybe a mobile app. There's a lot of options, but whatever that tool is, the channel of alumni communication is extremely valuable. So the objective is simple, right? Keep everyone who has ever engaged with you informed, okay? Stay in touch. How are you? And this needs to be routine communication. How are you this month? How are you this month, right? Keep in touch. And these are actually best done through low-cost channels. Social media, right? Mobile, just texting smartphone to smartphone, or a mobile app, or email. And what's interesting is during COVID-19, the email open rate has nearly tripled. Everyone is just sitting on their computer all day long. And so display ads are working again. Email is working again. Everybody's home, generally locked down still. And so snail mail, just good old fashioned direct mail, is working at an all-time high. So what do you provide to these audiences, right? How do you efficiently communicate to your alumni? You need to create gated content. So content that they have to opt in to receive and that only your other alumni or their family can see. This is best done on a private Facebook community, a mobile app, or a dedicated section of your website. So again, you should go back after my session today and check your Google My Business to see if it is truly robust and up to the minute. You should check your alumni, see how you're communicating with them or if you're communicating with them. And make sure that your website has this gated, dedicated content for that audience. Deepening the relationship beyond communication, right? So you can market to me all day long. That's what I do for a living. I can track you around the internet. I can serve ads to you. I can tell you to come back to my treatment center. But with community, it shows dedication. It shows that you're mission driven, that you're invested in people's long-term recovery, that you're part of a long-term solution. So hosting events, making sure that a national conference still goes on in its virtual version is extremely important, okay? We are all valued. This content is still available to all of us because this conference continues. What might you be able to do to host your own webinar style sessions or virtual conferences? How can you tailor other community events? I spoke to a client this morning about a super intense softball tournament that was planned involving celebrities and alumni and patients from multiple major cities, and it sounded really cool. That is community engagement, or the concept of a good old-fashioned 5K run fundraiser, right? Engagement, right? How do you show a community that you care? Well, a fully operational alumni program, that's going to lower relapse rates. That's going to provide support. It's going to help people with life skills and finding jobs. And that one night where they're just a little bit concerned that, hey, I might take a drink, right? If you get that phone call because they know you care, you can prevent that relapse. Or maybe they need to come back for more treatment, and that would be repeat business, right? But there would be a trusting, engaged relationship there. And it's low cost, right? The marketing for this isn't expensive paid ads. It isn't media. It's one person doing email and texting, maybe making some phone calls. It can be combined with an outcomes data effort, a research effort. And it can involve loved ones. You can call family members and say, hey, how's your loved one doing that went through our program? And finally, referrals, okay? It comes down to respect and trust. If your former patients who respect your facility, right, they're way, way, way more likely to refer you to family members, friends, and acquaintances. So it ends up becoming a referral channel, but that can't be the primary focus. It needs to be community and engagement. What do your peer organizations think of your facility or practice? This is interesting because I find that this industry has, I'll say, always played nice, right? You are competitors, but many of you refer patients back and forth based on levels of care, insurance coverage, best match for treatment or specialty programs like trauma and co-occurring disorders. But your reputation is a major, major issue, okay? There are gigantic treatment center operators right now that are struggling nationally, okay? There are publicly traded groups declaring bankruptcy. There are large campuses that can barely keep their staff on location. There are those concerned with COVID. There are outpatient centers shut down. So how do you keep your reputation relevant and to that one audience that cares about, your reviews and that sort of thing? How do you keep that on point for your marketing? So other professionals lend credibility. If Dr. Fauci told you that I was also a leading expert on pandemics, it would instantly give me more credibility on that topic. So similarly, all of you can benefit from each other, from your own network of peers and colleagues, actually posting these reviews online. So hint, hint, other professionals can leave you reviews on Google My Business, Facebook, etc. I have, most of the reviews from my own company are from clients and happy customers, but there's one or two that are from vendors. The group that built our office that was also a client, I believe our 401k manager left a review, but they said honest, sincere feedback about us. So think about that. If you work with a detox center and you're a private practice, if you work with a hospital and you're a detox center, who do you deal with, and do they respect you, and would they leave good reviews simply saying, I trust this person or organization with patients? So do you have this strategy in place formally, right, with professional partners? Do you make the first move and leave them good reviews? That's highly recommended. And just as you pursue web links from authoritative sites, right, you want to be listed on Yellow Pages, WebMD, whatever that may look like, but to value your SEO and rank higher, you need to pursue professional links, okay, from authoritative colleagues, social media, reviews, or even backlinks from their website to help your site rank higher. So again, we're talking about audiences. We're talking about how to address the right message to the right group so that your marketing benefits from it. The steady stream of professional referrals is one way to help reduce drastic fluctuations in admission rates, right? Seasonality. So the internet drives a ton of admissions year round, but it does trail off between Thanksgiving and Christmas. And there is typically a dip in the summertime. However, during a global pandemic, demand is at an all-time high through internet right now for admissions. But if you consistently had professional colleagues referring you, 1 or 2 patients a month, whatever that may look like for you, that's a dependable resource based on trust and good clinical service being provided. Google Trends, there's a lot going on, okay? And they don't have a little bit of an effect on your website and your success. They have a huge effect on your website success. Paying attention to Google Trends, paid and organic, is a good way to leverage opportunities and avoid pitfalls. There are constant small changes on Google. The algorithm, the way they approach locations, the way they verify addresses and information, and they are well-intentioned. Google does intend to give you tools and resources that would allow you to then invest a bit more in advertising. So they're trying to create a win-win, and they are consumer focused. They're not necessarily focused on you. They're focused on your patients and prospective patients finding the information they want rapidly. They even want them to find it without leaving Google's own ecosystem. So again, Google My Business becomes very important. Participating in AdWords to some level becomes important, running Google Ads. But here's an interesting tool. Google Trends, this is an actual piece of software, an actual tool. It's handy to see what current topics of public interest may affect your keywords, okay? Here's a quick example, but to oversimplify the whole concept, the prevailing trend, because of the rapid rise in mobile devices and people searching from a smartphone, Rehab near me is on an exponential growth curve, okay? It keeps getting searched more and more and more because when you're holding a mobile device, Rehab near me is automatically added. Google knows your location. Whereas Rehab Center or drug rehab has stayed flat for nearly 5 years. So there's exponential growth on Rehab near me, detox near me, that kind of thing. But Rehab Center and traditional keywords that used to perform phenomenally well, they still work, but they've stayed a bit stagnant. So that trend is actually on how consumers use their devices to search. You would then need to create content that names towns, locations, zip codes in order to show up in those near me search results. Let's talk about devices. So global pandemic. I can imagine how many hands would go up if I asked, how many of you have spent more time than usual on your desktop computer in the last 3 or 4 months, right? Desktop search is up massively, okay? Mid double digits. And so with desktop search being up, you're going to see that banner ads work, paid ads work at much better conversion rates than typical. And you have someone in a safe environment, right? They're in their home, they're doing their own research, so they're actually much more likely to interact with you and make an inquiry than if they're in the office, right? If you're in the office and you need to make a phone call and talk about your heroin addiction, that's a little bit sensitive, even if you step outside. But if you're home, working remote, drinking all day, you can still make that phone call, or your loved one can, by taking a step outside. So realize that these trends, okay, and there are massive shifts in these trends, They can be used to find relevant trending terms, irrelevant terms, where you may be wasting money. Okay. A shift in business models. You can identify whether MAT is an option for expansion, whether outpatient care needs to transition fully to telehealth. Okay. Telehealth utilization, which I will address, is up hundreds and hundreds of percentiles. Okay. It's every single American will have used telehealth by the end of the year. So realize that you can block keywords that aren't trending. You can keep your ads from running to those keywords and invest in keywords that are growing exponentially. And the goal here is that a trending search benefits you and an off-trend search does not burn your budget. You're staying efficient. Now let's talk about specific paid and organic search trends. Paid search trends. Google is telling us through their tool, through Google Trends, which you can Google to find, it can be used to better inform your campaigns. Let's look at seasonality, right? Should you spend more or less between Thanksgiving and Christmas? What is the trend at that time? Is there pent-up demand after a global pandemic of social isolation, social unrest, and massive unemployment? Yeah, we're projecting a 15 to 40% increase in residential care needs, okay? So the end result is going to be more effective if you follow the trend at minimizing waste and maximizing gains from that market shift. So stay on trend. You might be wrong if you just continue as planned prior. Organic search trends. This is extremely important. You need to write the words that you want to rank for, or you need to pay someone to do it. But writing content that makes readers and Google happy, not clinicians. Google reads at an 8th grade level based on the Fleisch-Kincaid reading score, okay? So to give them medical jargon does not help. The average American consumer, right? A lot of you use buzzwords and industry terms like dual diagnosis. Well, guess what? Having diabetes and hypoglycemia is a dual diagnosis. Having 2 types of cancer at the same time is a dual diagnosis or a co-occurring disorder. So you apply these terms to mental health diagnoses, which makes perfect sense, right? But realize that the consumer isn't going to type in, I need a dual diagnosis, depression, anxiety, and self-medication, painkiller treatment center. They're going to type in either their mental health condition like depression and the word treatment center, or they're going to type in the drug and the word treatment center, or they will self-identify. Men's rehab program, women's rehab program, men's depression help, right? Those are the kind of keywords that people search in highest volumes. And they'll add terms like near me, or Google will add that because they know where you are. Clinical phrases are overwhelming. Clinical phrases are boring. Your clinicians are in the top 1 or 2% of academics in the country, if not world. And so you would only be producing that content for yourselves. You need to produce user-friendly content to the multiple audiences, right? To alumni, to prospective patients, to their families, to your colleagues, okay? But that colleague content might need to be an email, not on your website. So generally, right, overdoing your content from a clinical perspective is going to lower the readability ranking of your web pages. It's going to minimize time on page. It's not going to help you convert to more business. Geographic targeting, however, right, using a lot of words about the town you're in and how you're supporting the local community and you sponsor the T-ball league or whatever that looks like, that is highly beneficial. So think about that, right? It's a little bit simpler to produce that kind of content than it is to produce, clinically relevant medical journal content. Now let's talk about telehealth. That's big, right? With telehealth, you're going to need to leverage this technology based on your use case, right? You only use telehealth in a specific way. Do not think you're the first person to come up with the following idea. I'm going to spend a ton of money on Google Ads, and since telehealth can be done remotely, I'll be the largest national provider. That would make you about the 300th person to give me that idea. So use telehealth the same way you deliver medicine now. Okay. If you would see 40 patients a week in your private practice office, then you should see 40 patients a week via telehealth in a COVID safe protocol. Okay. If you use telehealth for your alumni program, or you used to do group meetings, then you would now provide that solution via telehealth. So it is massively getting accepted by the American public. It is a super useful way to still capture revenue and maintain market share. But while it may be new in terms of application and use, it is not necessarily going to make you the disruptor of the industry. So let's talk about design and user experience, okay? Does your website's design get the job done? For most of you, no. Look at your own website. Does it even work on you, right? Does it draw you in? Is the design fresh? Most people hate their own website 18 months after it launches, right? The design gets old. Same reason you might buy new clothes before your old clothes wear out. You just want something that's on trend and looks a little nicer. So it's important to enhance your site's architecture and improve web user experience, okay? How you navigate the site, pretty pictures, modern graphics. And it's not always a tear down rebuild. It's just about not losing that interest, right? So poor architecture is going to create confusing navigation. Improper coding will break the site. It's going to create a negative web user experience. And confused visitors leave. Your bounce rate will be high. Your content will not be digested or downloaded. And you will not be helping anyone, right? So investing in that user experience helps people. And it also makes you money. It's how your livelihoods are funded. So realize that at short time on a web page, that data hurts your rankings, okay? What's called dwell time. So a bounce rate is the percentage of people that only come to one page of your website and then leave without navigating further. Sometimes that's okay because sometimes they still call you, right? Like a current patient might just be calling, or a family member might be calling to speak to a patient. But dwell time is good, okay? Somebody spending 2 or 3 minutes on your site reading something and then engaging you, you now have an informed consumer and you've already helped them. So you have trust. So focus on dwell time. What kind of design, what kind of materials or engagements could you offer via your website that are both prettier and more useful and capture attention? Higher conversions, okay, more phone calls, more leads, more inquiries, more patients. That depends on the best possible viewer experience on your website. So they need to get there and immediately be put at ease. You need to alleviate fear, demonstrate respect, and show comfort. Not luxury, comfort. So keep that in mind. I have said for years, and I'll say it again, pictures of beds and food go a very long way at establishing trust and driving new business. Targeting and refining your market size could save you a lot of money, okay? A lot of you overreach. So to maximize your marketing budget, and again, we're talking about efficiency today. I'm trying to talk about tactically navigating the COVID-19 environment, how to market to these multiple audiences cost effectively. So to maximize your budget, you simply need to correctly target your market size. Don't just blast $500,000 a month on, paid ads because it generates just enough phone calls to fill your beds. You might be wasting half of that money, okay? Millions of dollars a year. And at a small scale, if you have a limited budget, make sure that you're targeting enough of a market size, right? Don't just target your town. You might need to target your county. So is your target local, national, regional? What does it look like? Are you in a tri-state area, or are you an outpatient center only servicing one community, or an MAT clinic only servicing one neighborhood? So these things need to be defined before you start spending. You could be wasting not a little bit, you could be wasting the majority of your marketing dollars by directing the message to the wrong people in the wrong area. Let's give an example. Any major city, whatever city you're in or whatever city is closest to you, there are commonly poor areas in a city and wealthy suburbs outside of that city, right? Well, some of your models, particularly Medicaid and clinical models, those are going to be ideal for poor communities and servicing those in need in those communities. And the private campus-style flagship treatment centers that fuel a large segment of this industry, they'll be targeting those suburbs and wealthier white-collar audiences. So both are correct. Both will accomplish your business goals, right? But neither of you should be marketing in the other market. Your media spend needs to be efficient. Otherwise, you're just wasting it. You're not actually reaching a useful audience at all. And these ineffective campaigns, not only do they not fill beds, they're doing a disservice to your primary target market, right? If those dollars were allocated correctly and that content was produced correctly, not only would you not be wasting your time and money, you'd be helping more people that you're trying to help and that you're best suited to help. So the irony is the most profitable, most cost-efficient approach is also the most benevolent approach. So what we're going to talk about here is efficiency of spend, okay? That is what will give your business scalability. Even again, if you're a tiny private practice and you're struggling right now, make sure you're hitting the right market, and that will bring you back and give you scalability. Don't let the latest technology slip past you, okay? Are you taking advantage of what the latest technology has to offer? And I'm not talking telehealth, okay? We'll address that, but I'm saying simple tools and resources that are cheap and readily available that many of you are still not using, and you're falling behind the times. This industry on average is several years outdated. To ballpark that for you, 5 to 10 years outdated. And so trends that I've been working on with my team for years, when I speak to a lot of executives in the industry, they're new ideas. And that's alarming because these tools are actually inexpensive. Call tracking. There is software available for less than $100 a month where you can create multiple phone extensions that all ring to your normal telephone, and it will change the number on your website. So wherever the phone number shows up, it will automatically change based on how a user got to your website. So if they did an organic search, they'll see one phone number up top. If they come in from Facebook, they'll see a different phone number, and all of it rings to your main line. But it allows you, okay, to increase efficiency because now you know with great ease the success of each marketing channel. How many calls did I get from Facebook? How many calls did I get from Google My Business? How many calls came in from Bing? Wouldn't that be interesting to know, and wouldn't that be extremely useful in deploying your budget and your time? PHP 7. You don't really have to care what this is. If you've ever heard of HTML, hypertext markup language, that is the language that websites are built upon. And PHP 7 is a script. It is the latest and greatest version of how web geeks like me would program websites. Here's what it's about. If I built a website identical to yours using PHP 7, it would load 2 to 3 times faster. Google ranks fast-loading websites higher than slow-loading websites. So technically, just updating your website with the latest and greatest HTML, right, things that web geeks commonly know, it's going to reduce memory consumption on a computer, on your server. It's going to increase performance. And it's like a shot of adrenaline for WordPress, right? It's pure speed. So think about that and its application for simply ranking higher and providing, again, a better user experience, especially on mobile devices, for your audience. Telehealth. How should we be using it? Okay. Add telehealth as a service offering. Okay. This is going to be mandatory going forward. Things may not go back to normal. There is no new normal. Things are going to stay weird. And you've got to market your way through it. You've got to get real tactical and clever, okay? So use telehealth, but find an application for it that is most efficient. Is it best used for group meetings for alumni? Is it best used for actual delivery of one-on-one therapy? How else might you use it in an assessment? Many assessments are billable, right? Even for mental health primary. So can you have a clinician always staff telehealth 24/7? And then some of these assessments, whether or not a patient comes in, could generate revenue at least enough to cover their cost and the cost of the telehealth tools. So I'm just throwing out a few ideas. I've seen some very creative, a little bit more proprietary approaches by other companies that I won't divulge, but there is a lot you can do with telehealth as it applies to your business. But you do not need to be dependent on it. It's just a cool new thing. It's ancillary. Digital therapeutics apps, all year long, and not so much last year. I just see more and more and more web-based applications, mobile tools, simple plugins and widgets for assessment. But a lot of these are tailored therapy modules. Okay, a lot of these are things that you would clinically support, that you would deem very relevant to your business and to your patients. And they're coming to market, and they're not coming to replace you. I'm not talking about robots providing therapy or live chat that does your job for you. I'm just talking about useful therapeutic applications, taking people through virtual examples of interpersonal relationships, kind of workshop style applications. But you already have the clinical knowledge, okay? And you have time now, right, to translate it into your own application. So maybe you use some of the digital therapeutics that are available, and maybe it's time to create your own. Virtual tours. For several years, we've tried to convince clients to invest in virtual reality 3D tours of their treatment center, an actual guided walking tour. And you may have seen this on real estate listing websites and that sort of thing, but I'm talking about, a guided video tour using those cool VR cameras. And so right now, okay, picture two outreach people from residential treatment centers talking to each other. And one says, "Hey, we'd love to have you in for a tour. When can you fly down?" Well, the other outreach rep doesn't really want to go to an airport right now, doesn't really want to have to walk through a medical building right now. They're in fear of COVID, or they might have loved ones that are susceptible. So wouldn't it be easier if you could actually take a walking tour and video introductions to key staff members and learn about clinical programs, even if it costs money? Isn't that super viable right now? And it can show a safe environment. It can show the physical amenities and social distancing you might have put in place, the way I have seen restaurants show on video and on their websites how far apart their tables are now for social distancing. So when I talk about technology, don't miss out on an opportunity to stay on trend and hit the right audiences yet again. What should you know about schema? Okay, this is a web geek thing, but this is possibly the most important web geek thing that I know that you don't. Structured data. This is what fuels the internet. Is called schema markup. So if there is a database of the whole world and first names, last names, eye color, hair color, all that good stuff, okay? Just imagine that exists. This data has now been organized and sorted by category, relevancy, synonyms, right? And if you've ever done a search on Google or another search engine and it finishes your sentence for you, right? So you say shiny, red, it will either say Apple or sports car. That is schema. They know that those words are used in correlation with and relevant to the nouns that they would be adding, right? Apple or sports car. So now that it's been formatted in a repository or a database file, right? Just picture a giant Excel spreadsheet with everything about you. Facebook has it, Google has it. The irony is that can actually be used for way more effective processing and analysis. So you'll notice that advertisements, especially as you've been home in one place without moving, the ads are getting more and more relevant to you. People are all saying things like, "I think my phone is listening to me. I was just talking about that and then I got an ad for it." Well, probably you have a profile with all of the data about you that would serve that ad to you as simply highly relevant. So in web design, here's what's cool. You can program that into your website and it's not hard. And schema, when it comes to search engines, right? It's used to crawl your website, organize the content and the topics your content is about, and display it on search results. So schema is a replacement for keywords, and it's been in use for years. It's also free to use. It's just code. A web developer need to program it in. So it communicates to search engines what your data means. It would allow a page like men's rehab program to also rank for synonymously men's rehab center. I hope that makes sense, but we have evolved beyond the keyword. Keywords they're so 2002, okay? Now that we're getting with the times in 2020 with global pandemics and lots of home internet, schema is what you need to be relevant and categorized on the internet. Search engines can then display results that are more in tune with what their users are looking for. So you may have all noticed that if you do a search in California, you'll see different search results than you would see in Maryland, right? On a mobile device, we now see only mobile first search results. So Google shifted all of their search results to now match, no matter what device you're on, what was showing up on people's mobile devices. So better location-driven results, better personalized results. That is schema. It's used by more than 10 million websites, and it's used by Google My Business. You can look up a treatment center in your city, and you'll notice on some of the listings a little blue globe, and next to it, it will say their website mentions and whatever keyword you searched, right? Their website mentions men's rehab program. So that schema is extremely relevant. It can be pulled out of your Gmail, right, or your email sends, and it can be pulled off of web pages. Use it. Now, what do you need to know about this mobile first search, okay? Your website, again, is not built for how pretty it looks on a high resolution 4K monitor. Your website should be built for a phone. And if someone's holding a phone, they're able to call you. So I'm saying this is common sense, but most of you watching right now have not done this. 9 out of 10 visitors are lost due to a low mobile-friendly experience. So out of every 10 people that leave your site, it's because they had a bad experience on their phone. That sounds like your fault, not theirs. So 57% of those people that leave your site will not recommend a company with a poorly designed mobile site. The most common referral relationship in America, and all of you do this. Hey, tell me about that one plumber you used, or hey, didn't you have a lawn mowing service? You will text them a link to the company's website or Google My Business profile. You will lose 57% of that business if you have a weak mobile experience. Google prioritizes a sub 5-second load speed, okay? If your site loads in 5 seconds or less, you will have a 70% increase in viewing time on your website, that dwell time I mentioned earlier. And Google might now eliminate your web page from rankings in a mobile search if it's not mobile friendly. So they'll just assume that you haven't updated your website in years and years and years, and you're part of the old internet that they don't really want to have in search results anymore. So if you're not mobile first and all of search results are mobile first, then you're invisible. And if you like being invisible, that's cool. It's a superpower, but I would not want my business to be invisible. 50%, more than 50%, excuse me, who are let down by a mobile version of a business think negatively about the business. So it's not simply that they didn't engage you. They now don't like you. You have inconvenienced the patient, okay? Or you've inconvenienced your peer colleague, even worse. So realize that additionally, 50% or more will stop using a website on a mobile device if they find content is useless or the layout is complicated. So we need to look at trends like one-touch calling, right? If there's a form to fill out, it needs to be short on a phone. If there's a long clinical form with all these questions, that's going to take forever when I'm typing with my thumbs and I'm busy being drunk, you know? So think from the mindset of the consumer, think about the inconvenience versus the simplicity of a phenomenal mobile experience. If I tell you to think right now of your favorite app that you've been using during the pandemic, what is your favorite one just in general? Most of you are going to say something like Amazon Prime, right? A lot of you are going to talk about Spotify or YouTube apps. So think about that and how simple the user experience is. You do a search, with one touch, you find your results and you're happy. But if it was super inconvenient, you would very much dislike and blame that brand. The multiplier effect. So what is this all leading towards? What am I trying to get you to do? I am trying to get you to work smarter, not harder, okay? We have seen massive growth during the pandemic for all of our mental health and substance abuse portfolio, okay? Demand is at an all-time high. Alcohol purchases are at an all-time high. Overdose deaths are at an all-time high. Social isolation is at an all-time high. You should already be experiencing growth in your business, okay? This is bad for mankind, but it is beneficial to your market share and business. And I do not say that callously. I'm saying that be targeted, be on trend. There should be a multiplier in play for you. What is it? How does this help you? Okay, so the multiplier effect, this is a reference to an increase in pure income, in revenue. And I'm comfortable talking about business. It's okay for you to make money. It's okay for you to get paid helping people. Go look in the mirror and tell yourself that. It's okay to get paid for helping people. And think of the world's most talented neurosurgeons and pandemic experts. And you would hope that they are are great, and you'd hope that they get paid well. So you deserve that too. In marketing, a multiplier effect supports all of your outreach efforts. So if you have a salesperson or outreach rep and they're well networked and they're making their rounds, and right now they're isolated, so they're making phone calls and taking Zoom meetings all day long, your website should capture a whole lot more people as a result of that. So maybe I forgot your last name, or maybe I didn't get a business card because it was a virtual meeting and I don't have your cell phone number. All of those people that interacted with you somehow will convert through the internet. They'll come in through search or through some mechanism like voice search and a digital assistant. They'll find your website or your Google My Business listing and they'll call you. So realize the more efficient you are in your digital marketing, the shorter the path that a consumer from another marketing effort needs to take to find you. If you have a billboard or a print ad or a brochure, let's say that you have a phenomenal referral partner. Let's say you're a large treatment center and you have a private practice that sends you a lot of patients, but the doctor there, the clinician, has your business card on their desk and they haven't been to their office in months. Okay, they're doing telehealth. They could have referred you a ton of business, which would be a multiplier, right? If they had a digital version of that information. And probably they just Google you and send the info over that way, but keep that in mind. Spend more on your website, and I mean time or money. Just realize that it is the gateway to communicating with your business, right? Improve its SEO value, which is permanent. It's like the equity in a house, right? So get your website to be a better experience for your multiple audiences, get it to rank higher in search results, okay? Increase traffic as a result, and then get more conversions from your offline efforts, from your salespeople, from the events that you support, from speaking at a conference on the internet, okay? People will, as a result of this talk, they will directly look at my website. So for you, what would that mean if you're talking about clinical expertise and demonstrating that online after someone had a good experience interacting with your brand offline? It means you're going to fill more beds. Now look at this in terms of a budget. Spending more in your paid search, okay? Just more clicks, more raw traffic to your site and your landing pages. This will improve it. And I mean, even at a small scale, I'm not just talking about big spenders. This will improve the return traffic to your site, right? People that come in the first time from paid ads who come back later by directly typing in your domain or doing an organic search. So the first visit costs you, but the follow-up visits have no cost at all, and you'll continue to expand and grow with a multiplier effect. Now, let's talk about traditional media. There has been a lot of talk about radio, digital radio, OTT streaming ads. We are doing a lot of that right now with Hulu and online streaming channels. YouTube is seeing massive viewership right now. So to convert even your Google Ads campaigns into some extent on YouTube would be a good idea. But no, the radio ad that you're running, right, did not get phone calls. But don't turn it off because it got your website phone calls. So all of this traditional media, all of this outreach, everything else you're doing, it might not convert directly through those channels, but you need to test whether or not there was an increase directly correlated to that budget or effort through your website, because that's how you shop and that's how your patients shop. So your marketing budget could be based on assumptions and bad data. We all know what happens when you assume. So to avoid that, as you set your marketing budget, realize that you could be wrong. And it's that simple. I'm not always right. That's probably the only time I'll ever say that on camera, but you might not always be right either. So if your data is bad or old or following a prior trend and is not currently on trend, you're going to draw conclusions from historical data when you should be looking at future projections, right? If you planned out your paid search campaign in January, I guarantee you it's gone a whole other direction since then. And so that data would be meaningless to fuel your decisions. You could be evaluating your marketing too little and too seldom, right? So what used to be monthly check-ins with the team and you check your analytics, you might need to be looking at weekly or daily. That frequency has changed. And there's risk in looking at your marketing too seldom. Even if you're just hunkered down and your business is closed and you're terrified, Look at your data, look at your traffic. There might be opportunity for you to deploy something new and capitalize on it. If you're used to networking, then maybe you need to do virtual networking. Don't just give up. So realize that if you've taken a wrong turn, you need to rapidly get off that road as soon as possible. You need to stop right now and reposition, not continue down it and cross your fingers and close your eyes, right? So hoping that you'll eventually wind up in the right place in these conditions will not happen. And you might not be keeping up with the frantic pace of technology, and you might not, be the same expert you were 6 months ago, but that's okay. You need to evaluate different data and not assume. Tried and true marketing methods have their place. Okay, so what if I am wrong, Dan? What about this? What about that? Just don't ignore traditional marketing, okay? It works. Getting a good piece of mail works. Getting email that's relevant to you works. Finding out people care, right? I can't tell you how many commercials I've seen from Panera and Chevrolet and all these big brands about how they've got our back during the pandemic. I'm not quite sure how, but I feel like they care, right? It's good marketing. So email is still a powerful and cost-effective tool, okay? For every dollar you spend on email, this is historical average. 2018 was the last data I pulled, but you could expect an average of $32 in revenue, okay? So think alumni and referral partners, you should be emailing. A lot of you registered for this conference because of direct email. Few other marketing options can even come close to matching the ROI of email marketing. It is cheap and it's relatively easy, but even at low percentages, it works. Family is one audience. Outcomes tracking is a good reason to email someone, alumni. Community support. Hey, everybody, tune in for our fun community event, whatever it may be. Everybody bake cookies from home and show us what kind you made. Haha. Whatever that may be, whatever your reason for engagement, do not ignore email and traditional marketing methods. How is communication within your treatment center? Okay. Effective communication is crucial in any company's marketing. That doesn't always happen. So what does the friction look like? I'm sure it's there between your admissions department, your marketing department, and your admissions people, right? The issue potentially, right, is that both parties, even though they have the best intentions, right, they're essentially working against each other. They want credit for that admission, even if they're not compensated that way, right? The pride they would take in their work is, hey, I was able to generate admissions during a pandemic. No, I did that. No, I did that. So to avoid infighting, all you need is clear communication. This lack of consistent, meaningful communication and shared goals would be your fault, right, in not communicating them. And they need to be realistic. So if you were growing last year, month over month by a crazy rate, guess what? That's not likely to happen in these conditions, but there is pent up demand of 15 to 40%. So there will be a time for rapid growth soon. Stay reasonable, stay fair, and be realistic with your expectations and in your communication with staff. Sometimes you need help, but resources abound. So while this is not your intervention today, I at least want it to be an awakening that you do not need to be a jack of all trades. You do not need to fear for your job just because of a pandemic, right? If your trusted staff or yourself, if you are out of your depth, given how fast these digital marketing trends and technology change, if you're asking like, well, how do I keep up with all of this, Dan? I mean, this is what you do for a living. I am telling you that no one will judge you for saying, no boss will judge you for saying that to them. If you are the owner of a business, you need to realize it's nearly impossible for one person to stay on trend with all of this information, right? So look out to consultants, read content, read blogs, Google these things that I'm sharing with you, but consultants, freelancers, agencies, right? You can partner with your existing marketing personnel and have them fulfill some component. And a technical consultant can come in and just tell you what's wrong. Like, oops, you missed a trend, right? Or that's not how I would use telehealth. So these resources are more available than they've ever been during the pandemic. And CEOs are picking up the phone. You've got time and ability to engage these groups at low cost. So don't think you have to do everything internally. I'm not saying this for me. I'm saying that you could engage anyone. And there's a lot of people on the job market right now to help keep things moving. You need to look for specialists. So if you're weak on email, find an email specialist. If you're weak on SEO, find an SEO specialist. If you don't have the time to write, a 600-word article every single day, find a writer. But these outside experts, they're going to bring you unbiased results. They'll bring you deliverables or an objective viewpoint that can quickly educate you and get you back on trend, right? That would be the advantage. Whether they're permanent or not doesn't matter. But this is from PR to web to outreach. I'm talking all marketing channels here. Consider tagging in an expert to find out what's going on with the pandemic. How do I benefit from it, right? How do I help the most people and grow my business during a global pandemic? That's the question we're all asking, right? And the demand is there for mental health and substance abuse at all levels of care. Demand is there. So deploying a contract relationship, right? You could have temporary costs, one-time updates. That concept of just returning your focus to your primary job responsibilities, but maintain scalability. And with that, hopefully we've gone through and covered all of these goals, but identified our website's audiences and how to reach them, okay? Families, professionals, patients, each other. Identified external audiences and how to reach them. Talked about the current trends and environments, paid search, email, telehealth. How to build a data-backed marketing plan, right? The general trend there is your data historically might be useful or might be wrong. Don't forget to look at future trending data. Hopefully you have a bit more of an understanding on how to target marketing to be cost efficient, right? Not cheap, but cost efficient by directing it to a specific channel, to a specific audience, and understanding this general concept of the multiplier effect. So all of that blended with, again, stronger user interface and user experience on your web design, traditional marketing methods still being relevant. I want you to all walk away realizing there is a new abnormal to embrace, but traditional methods work. Focus and efficiency, right, are what you should be taking a look at right now. And keep an eye on your reputation because people can help you with that. So that said, we will take some questions today, but I hope you enjoyed the presentation. Please do take a look at our booth in the exhibit hall, the NCAT exhibit hall today. And we are doing a Baltimore in a Box giveaway for those of you that go to Dreamscape's Facebook page and just add the word crab cakes on the NCAT post. So thank you all for your time and look for me at an upcoming conference or virtual conference.
Thank you, Dan. That was always an entertaining and very informational session. We have time for a question, and the most liked question that we received is, what should you do if you receive a bad review on Google My Business? How should providers monitor this? We only have a couple minutes, but what do you recommend?
Sure. So I highly recommend getting as many positive reviews as you can, right? The best defense is a good offense. And my point earlier was that you can get those reviews from each other, from your vendors, from your landlord, right? Whatever that looks like. And have it be real, right? If your landlord leaves a review, have them say either nothing, just 5 stars, or what a great tenant, they pay their bills. So you can get some semblance of good reviews that way. Always reply. So if it's a bad review and it's from an actual patient, say we cannot comment on, patient's presence due to HIPAA compliance. But if you are a patient or the relative of a patient, please call this number, right? A lot of the time when they call that number, you can just ask, hey, what's up with the angry review? How can I help you? Could you maybe take that down and talk through this with us? So don't flinch. Don't hesitate to engage. Always reply. I have seen a trend, unfortunately, from real accounts where treatment centers have left bad false reviews on other treatment centers, and it's very difficult to get them removed because they look real and they're attached to real accounts. So again, go out and get a bunch of good reviews as best as you can. Always ask happy patients to, leave you a review when they're happy, and try to do things that way.
Thank you, Dan. Now, unfortunately, ladies and gentlemen, or maybe fortunately, Dan is just so eloquent that we're actually out of time. However, I know there were questions from the audience. If you simply go to the exhibit hall, there's a form in the Dreamscape booth. You can ask any questions there. Dan also regularly does webinars with the Psychiatry and Behavioral Health Learning Network as well. Trust me, you can reach Dan. His phone number, email, and LinkedIn accounts are below. Dan, I'd like to thank you for a wonderful presentation, and thank you, ladies and gentlemen, for joining us. We look forward to seeing you in the next session.
Thank you, everyone.